had a patient come in last week. Let's call her Margaret. She is 68, has moderate COPD, and she was doing everything her GP told her to do. Taking her inhalers religiously, going for walks every day, even joined pulmonary rehab classes. But she kept getting more and more breathless, especially after meals. She was frustrated because she thought she was doing everything right. So I asked her to walk me through her typical day, particularly what she was eating. And she said, well doctor, I eat healthy. Lots of vegetables, broccoli, cauliflower, low-fat milk in my tea, some bacon for protein, and I drink sparkling water to stay hydrated. And that's when I knew exactly what was the problem. Margaret was eating 5 foods that were secretly restricting her airways and making her breathlessness worse. And what's shocking? Most people think these foods are healthy. Hello, I'm Dr. Suman Paul, a respiratory consultant here in the UK. And today, I am going to break down the 5 food that can worsen breathlessness if you have COPD, asthma or heart failure, and exactly what to eat instead. Number 1, and this is the most important one, processed meat and high sodium food. I am talking about bacon, sausage, ham, salami, canned soups, salted crisps and ready-made meals. Now here is what's happening inside your body that most doctors won't take the time to explain. First, high sodium causes your body to retain fluid. When you retain fluid, it doesn't just show up as swollen ankles. It can accumulate in your lung tissue. This makes gas exchange more difficult and increases breathlessness. But there is something even more concerning about processed meat specifically. They contain preservatives called sodium nitrite. These chemicals generate something called reactive nitrogen species, which damages the elastic fibers in your lungs. The same fibers that allow your lungs to expand and contract properly. In fact, a study published in the European Respiratory Journal found that people who frequently eat processed meat have more than double the risk of COPD hospital admission. It's essentially causing damage similar to smoking. This is especially problematic if you are over 60 because your lungs are already losing elasticity naturally as you age. Adding nitrite damage on top of that accelerates the decline of your lung function. So here is what to do instead. Switch to fresh chicken, fish, or plant-based proteins like lentils. When you are cooking, use herbs and spices instead of salt. Cumin, paprika, garlic powder, black pepper. You will be shocked how much flavor you can get without the sodium. And if you are buying anything packaged, look at the sodium content. Aim for less than 400 milligrams per serving. Now, the next food might actually surprise you because everyone thinks it's a superfood. Number 2, certain vegetables, particularly cruciferous ones like broccoli, cauliflower, Brussels sprouts and cabbage. Now, before you think I have lost my mind telling you to avoid vegetables, let me explain. There are healthy foods packed with vitamin, antioxidants, all the good stuff. But if you have COPD or severe asthma, they can cause a very specific problems. These vegetables ferment in your gut and produce gas. Now you might think, so what? Everyone gets a bit bloated after eating vegetables. But here is why it's different for you. When you have COPD, your lungs are hyperinflated. They are essentially trapped in an inflated state because you can't exhale properly. This pushes your diaphragm, the main breathing muscle, downward, leaving it flattened and weak. Now, when your stomach fills with gas from these vegetables, it expands upward. And where does it push? Right up against that already flattened diaphragm. Suddenly, you literally cannot take a full breath because your diaphragm has nowhere to go. It's like trying to blow up a balloon inside a sealed box. There is just no room. This particularly affects people with moderate to severe COPD or anyone who already feels full or bloated after a meal. Here is the good news. You don't have to eliminate these vegetables entirely. First option, cook them thoroughly. Steaming or boiling breaks down the fibers that cause gas. Raw broccoli is much worse than cooked broccoli. Second, eat smaller portions. Instead of a whole plate of cauliflower, have a small side portion. Third, swap some of them for lower gas vegetable like spinach, courgettes, carrots, green beans. These are all excellent choices that won't cause the same bloating. And one more thing, avoid carbonated drinks entirely. Fizzy water, soda, beer, they are just pumping gas directly into your stomach. Stick to still water. Now the next one is controversial and I need to set the record straight because there is a lot of misinformation out there. Number 3, dairy product, particularly full-fat milk and cheese. Now here is where I need to be very careful with the science because there is a common myth that dairy causes mucus production. And I am going to tell you right now that myth is not supported by clinical research. Multiple studies, including randomized controlled trials, have shown that dairy does not actually increase mucus production in your lungs. So if someone is telling you to completely avoid dairy because of mucus, they are not giving you the full picture. However, and this is important, dairy does make your saliva feel thicker in your throat. It's called flocculation. Milk proteins interact with your saliva and create this coating sensation. Now, for a healthy person, that's not a problem. But if you have COPD with a weak cough reflux, or if you have difficulty clearing your throat, that sensation of thicker saliva can be very uncomfortable. It can make you feel like you are constantly trying to clear your throat, which increases breathlessness. Plus, full-fat dairy can also worsen acid reflux, which brings me to another point. When you lie down after consuming dairy, especially before bedtime, content can irritate your airways and trigger coughing and breathlessness during your night. So here is my recommendation. Don't ban dairy entirely unless you are specifically lactose intolerant, but make these modifications. 1. Switch to low-fat or plant-based alternatives like almond milk or oat milk. 2. Avoid consuming dairy within 3 hours of your bedtime. 3. If you notice increased throat clearing or nighttime coughing after dairy, that's your signal to cut back. The key here is listening to your own body. Some of my patients do absolutely fine with dairy, others notice a clear difference when they reduce it. Number 4. Fried and high-fat food. Fast food, fried chicken, chips, greasy takeaway, fatty food do 3 problematic things. First, they slow down your stomach emptying. Your stomach takes longer to digest than greasy meal, which means you feel full and bloated for hours. Again, that bloating pushes up against your diaphragm and restricts your breathing. Second, they are major triggers for acid reflux. About 60 to 80% of the asthma patients also have gastroesophageal reflux disease. When acid comes up from your stomach into your esophagus, it can trigger a vagal reflex that causes your airways to constrict. You get breathless without even realizing it's connected to what you ate 2 hours ago. And the third, high-fat meals cause inflammation throughout your body, including your airways. Chronic inflammation makes asthma and COPD worse over time. Switch to baked, grilled, or steamed food. If you are going to have oil, use small amounts of olive oil or avocado oil. And here is a practical tip. If you get breathless after meals, try eating 5 or 6 small meals throughout the day instead of 3 large ones. This prevents your stomach from ever getting too full and pressing on your diaphragm. Number 5. High carbohydrate refined food. White bread, pasta, pastries, sugary cereals and biscuits. This one's a bit more biochemical, but stay with me because it's fascinating. When your body metabolizes carbohydrates, it produces carbon dioxide. Now, in a healthy person, you just breathe out that CO2, no problem. But if you have COPD, your lungs struggle to get rid of CO2 effectively. So when you eat high-carb meal, your body produces more carbon dioxide than your damaged lungs can clear. The result, CO2 buildup, which makes you feel breathless and fatigued. It's called your respiratory quotient, the ratio of CO2 produced to oxygen consumed. Carbs have the highest respiratory quotient, meaning they generate the most CO2. So instead of high carb and high sugar food, focus on complex carbohydrate and balance them with protein and healthy fat. So instead of white toast for breakfast, have a whole grain toast with eggs and avocado. Instead of pasta with tomato sauce, have a smaller portion of whole wheat pasta with grilled chicken and vegetables. You are still getting carbohydrate, but you are not overloading your system. Now, there is one more group I want to specifically mention, especially for asthma patients: sulfite containing food. Sulfites are preservatives found in wine, dried food, and processed potatoes. Anything that says E220 to E228 on the label. About 3 to 10% of asthma patients are sensitive to sulfite, and it can trigger immediate bronchoconstriction, meaning your airways literally clamp shut. If you notice wheezing or breathlessness after wine or dried apricot, get tested for sulfite sensitivity. It's a simple thing to identify and avoid. So let's recap. The 5 main food that can worsen breathlessness are processed meat and high sodium food, gas-producing cruciferous vegetables in large amount, full-fat dairy, especially before bed, fried and fatty food, refined high-carb food. Now, I want to be very clear, adjusting your diet is not going to cure COPD or asthma, but it can significantly reduce your symptom burden, help you breathe easier, and improve your quality of life day to day. A quick word before I finish. I am a doctor, but I am not your doctor. This video is for educational purposes only, and it's not a substitute for personalized medical advice. If you are having severe breathlessness, chest pain, or any concerning symptoms, please seek immediate medical attention. If you found this video helpful, please share it with someone who needs it. A family member with COPD, a friend with asthma, and let me know in the comments which of the foods surprise you the most. I read every comment and I will respond to your questions. Thank you for watching. I'm Dr. Suman Paul and I will see you in the next video.